Question 1. Which task should the RN delegate to a licensed practical nurse, LPN? A. Teaching a newly diagnosed diabetic about insulin administration. B. Assessing a patient's response to a new pain medication. C. Administering oral medications to a stable post-op patient. D. Developing a care plan for a patient with pneumonia. Answer. C. Administering oral medications to a stable post-op patient. Question 2. What is the most appropriate action if a nurse discovers a fire in a patient's room? A. Extinguish the fire first. B. Rescue the patient. C. Sound the alarm. D. Confine the fire by closing the door. Answer. B. Rescue the patient. Question 3. Which is the safest method for confirming nasogastric tube placement before feeding? A. Injecting air and auscultating the stomach. B. Observing the client for coughing. C. Testing pH of aspirated contents. D. Asking the patient if the tube feels in place. Answer. C. Testing pH of aspirated contents. Question 4. A nurse finds an unconscious client on the floor. What is the first action? A. Call the provider. B. Check for pulse and breathing. C. Move the client to the bed. D. Notify the family. Answer. B. Check for pulse and breathing. Question 5. What is the nurse's priority when receiving a telephone prescription? A. Write it down and wait for confirmation. B. Repeat the order back for verification. C. Trust the provider and proceed. D. Wait to enter it at the end of shift. Answer. B. Repeat the order back for verification. Question 6. Which action is appropriate to reduce the risk of healthcare-associated infections? A. Using gloves for all patient care. B. Washing hands before and after patient contact. C. Wearing gowns in all patient rooms. D. Using alcohol-based sanitizer once per shift. Answer. B. Washing hands before and after patient contact. Question 7. A patient reports dizziness when standing. What is the safest nursing intervention? A. Encourage daily exercise. B. Instruct the patient to get up quickly. C. Teach to change positions slowly. D. Give extra fluids. Answer. C. Teach to change positions slowly. Question 8. Which finding is a safety concern that must be addressed immediately? A. Patient walking with slippers. B. Call light out of reach. C. Bed at lowest position. D. For pole at bedside. Answer. B. Call light out of reach. Question 9. What is the priority when using restraints? A. Prevent injury to staff. B. Ensure patient comfort. C. Use the least restrictive method. D. Keep restraints on throughout shift. Answer. C. Use the least restrictive method. Question 10. What is the most appropriate nursing action after a medication error? A. Document the error in the chart. B. Notify the provider and monitor the patient. C. Avoid mentioning the error to the patient. D. Tell the next shift nurse only. Answer. B. Notify the provider and monitor the patient. Question 11. A confused patient attempts to get out of bed. What is the best action? A. Apply wrist restraints. B. Assign a sitter to stay with the patient. C. Turn off bed alarm. D. Remove call light. Answer. B. Assign a sitter to stay with the patient. Question 12. The nurse must delegate feeding to a UAP. Which patient is most appropriate? A. A patient with dysphagia and thickened liquids. B. A new stroke patient with swallowing difficulty. C. A patient who feeds self slowly. D. A patient with continuous tube feeding. Answer. C. A patient who feeds self slowly. Question 13. A nurse notices a frayed electrical cord on an 4 pump. What should be done first? A. Continue using the pump. B. Tape the cord temporarily. C. Unplug the equipment and tag it for maintenance. D. Call housekeeping. Answer: C. Unplug the equipment and tag it for maintenance. Question 14. What is the most important nursing responsibility when transferring a client? A. Notify the patient's family. B. Ensure the client's belongings are packed. C. Confirm the receiving unit is ready. D. Provide a complete handoff report. Answer: D. Provide a complete handoff report. Question 15. Which patient is at highest risk for a medication error? A. A patient who self-administers at home. B. A patient transferred between units. C. A patient with controlled diabetes. D. A patient on one medication. Answer: B. A patient transferred between units. Question 16. What is the safest response to a patient requesting medication that is not in the MAR? A. Provide the medication if the patient confirms it. B. Refuse and walk away. C. Call the provider to clarify. D. Borrow it from another patient's supply. Answer: C. Call the provider to clarify. Question 17. The nurse observes a UAP removing a urinary catheter. What is the priority action? A. Praise the UAP. B. Intervene and stop the procedure. C. Document the procedure was done. D. Report it as an incident. Answer: B. Intervene and stop the procedure. Question 18. What is the best method to identify a patient with altered consciousness? A. Ask the family to confirm. B. Check ID bracelet and medical record number. C. Use the room number. D. Wait until the patient is alert. Answer: B. Check ID bracelet and medical record number. Question 19. What is the nurse's best action if a patient brings home medications into the hospital? A. Return them to the patient's room. B. Send them to the pharmacy for verification. C. Discard them immediately. D. Lock them in the nurse's station. Answer: B. Send them to the pharmacy for verification. Question 20. Which is the safest action before performing any invasive procedure? A. Tell the patient what will happen. B. Obtain informed consent. C. Call the family for permission. D. Verify the time of the last meal. Answer: B. Obtain informed consent. Question 21. A nurse witnesses another nurse give the wrong medication. What is the priority action? A. Report the incident to the nurse manager. B. Encourage the nurse to complete an incident report. C. Ensure the patient is assessed for adverse effects. D. Document the error in the nurse's notes. Answer: C. Ensure the patient is assessed for adverse effects. Question 22. Which of the following is the best example of a near miss in patient safety? A. A medication is given late but without consequence. B. A medication error is caught before administration. C. A patient develops an infection after surgery. D. A patient falls and breaks a hip. Answer: B. A medication error is caught before administration. Question 23. A client with dementia wanders frequently. What is the best strategy to ensure safety? A. Use physical restraints. B. Assign a room close to the nurse's station. C. Administer sedatives at night. D. Lock the door from the inside. Answer: B. Assign a room close to the nurse's station. Question 24. What is the most effective way to reduce catheter-associated urinary tract infections, CAUTIs? A. Replace catheters every 3 days. B. Perform routine bladder irrigation. C. Discontinue catheter use as soon as possible. D. Use antiseptic solutions daily. Answer: C. Discontinue catheter use as soon as possible. Question 25. During shift handoff, which approach best promotes patient safety? A. Provide verbal report only. B. Use the SBR format. C. Focus on personal opinions. D. Document at the end of the shift. Answer. B. Use the SBR format. Question 26. A nurse must delegate a task to a UAP. Which task is appropriate? A. Inserting a Foley catheter. B. Assisting a stable patient with ambulation. C. Educating a patient about discharge medications. D. Assessing a wound for signs of infection. Answer. B. Assisting a stable patient with ambulation. Question 27. Which is a priority safety concern for a client receiving oxygen therapy? A. Keeping the oxygen tank upright. B. Ensuring electrical equipment is grounded. C. Placing petroleum-based products near the nasal cannula. D. Setting oxygen flow at 10 liters per minute. Answer. B. Ensuring electrical equipment is grounded. Question 28. Which action is most appropriate before administering a blood transfusion? A. Check blood type with the lab technician. B. Warm the blood to body temperature. C. Verify the patient and blood information with another RN. D. Prime tubing with dextrose 5%. Answer. C. Verify the patient and blood information with another RN. Question 29. A nurse finds a patient on the floor who states, "I fell." What is the priority nursing action? A. Assist the patient back to bed. B. Document the fall in the chart. C. Assess the patient for injury. D. Notify the healthcare provider immediately. Answer. C. Assess the patient for injury. Question 30. What is the best way to prevent wrong site surgery? A. Ask the circulating nurse to confirm. B. Mark the surgical site with the patient awake. C. Use colored drapes on the correct side. D. Rely on the consent form. Answer. B. Mark the surgical site with the patient awake. Question 31. The nurse assigns a float RN from pediatrics to a telemetry unit. Which task is safest? A. Interpret cardiac rhythms. B. Monitor vital signs for a stable patient. C. Adjust 4 drips for titration. D. Educate a patient on heart failure management. Answer. B. Monitor vital signs for a stable patient. Question 32. A nurse must teach a newly diagnosed diabetic patient. What is the safest approach? A. Delegate the task to an LPN. B. Have the UAP demonstrate insulin drawing. C. Teach and verify understanding through return demonstration. D. Hand out printed instructions only. Answer. C. Teach and verify understanding through return demonstration. Question 33. Which patient is the highest priority for fall prevention? A. A patient with bilateral arm casts. B. A patient on bed rest post-op day 2. C. A confused patient with a history of falls. D. A patient with a PCA pump. Answer. C. A confused patient with a history of falls. Question 34. A patient on anticoagulation therapy needs injection. What site is safest? A. Deltoid. B. Ventrogluteal. C. Dorsogluteal. D. Abdomen. Answer. B. Ventrogluteal. Question 35. What is the nurse's priority before applying a wrist restraint? A. Notify the provider. B. Obtain a signed consent. C. Document the need for restraint. D. Try alternative methods first. Answer. D. Try alternative methods first. Question 36. Which medication order requires the nurse to question it immediately? A. Warfarin 5 mg PO daily. B. Insulin 10 units SQ before meals. C. Morphine 2 milligrams for every 4 hours PRN. D. Potassium chloride 40 milliequivalent for push. Answer: D. Potassium chloride 40 milliequivalent for push. Question 37. Which scenario best reflects a sentinel event? A. Patient develops a pressure ulcer. B. Patient receives the wrong diet tray. C. Patient dies after receiving the wrong blood type. D. Patient gets a rash from adhesive tape. Answer: C. Patient dies after receiving the wrong blood type. Question 38. A patient is receiving PCA morphine. What is the nurse's priority? A. Encourage deep breathing exercises. B. Monitor for constipation. C. Assess level of consciousness and respiratory rate. D. Record the number of doses used. Answer: C. Assess level of consciousness and respiratory rate. Question 39. UAP reports a patient's blood pressure is 80/60. What should the nurse do first? A. Recheck the blood pressure. B. Notify the healthcare provider. C. Document the finding. D. Instruct the UAP to elevate the legs. Answer: A. Recheck the blood pressure. Question 40. What is the first action if a nurse discovers a medication dosage discrepancy on the MAR? A. Administer the ordered dose. B. Notify the provider for clarification. C. Adjust the dose based on the drug handbook. D. Ask a colleague for advice. Answer: B. Notify the provider for clarification. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.